Hello, my name is Dr. Alexis Brown, and this video is to go over what to expect after you have a dental crown or filling here at Family Holistic Dentistry. So immediately after you have a dental crown or filling, you will be numb after the appointment. So on average, the numbness will last 3 to 4 hours after your procedure. There are some people who metabolize quicker, so they'll be unnumbed faster. There are some people who metabolize slower, and so they'll be numb longer. So you just want to just listen to your body, and while you're still numb, you do not want to be chewing or eating anything while that numbness is still there. Soft foods like smoothies, yogurts, bananas, and avocados, things that are really soft consistency like that, are okay because you're not actively chewing your teeth. When you are numb, it is possible to accidentally bite your cheek, tongue, or lip. So we want to avoid that trauma at all possible. So things that can happen after any injection is some soreness in the injection site and or muscle trismus. Soreness at the site is common, and it can last for 1 to 5 days, and this typically gets better with time each day, the soreness getting less and less. In rare cases, the muscle trismus can occur, which is like a muscle spasm that limits the jaw opening. So when you try to open your jaw, it'll feel really tight and sore. This doesn't happen too terribly often, but it is a possibility with any injection that happens in or close to muscles. It typically occurs on the lower back molars, just based on the anatomy and where we have to place the anesthetic. And it typically can take a longer period of time to heal, about 2 to 8 weeks to resolve. You really want to just be gentle with the muscles in the jaw, chew soft foods, warm compresses on the area, red light therapy. With the red light therapy, I typically recommend about 20 to 30 minutes, 3 times a day. That really increases the ATP production inside the mitochondrial cells to help with the healing of the muscle. Another thing you want to do is avoid opening your jaw really wide. So when you feel that, tightness or soreness in the muscle, you don't want to push it beyond its what your body's telling you. Some people think if they do exercises to help loosen the muscles, it will help. This is not true. It actually will slow and prolong the soreness in the muscles. Another thing that can be helpful is over-the-counter medications like acetaminophen, usually about 500 milligrams, and then ibuprofen, 600 to 800 milligrams, and that's typically about every 6 to 8 hours for both of those. Homeopathics are also good for the pain, like Arnica. We also offer these in the office if you need any of those at the end of treatment. The next rare finding that can happen after the anesthetic is a hematoma, bruising, or swelling. This typically happens in the upper arch, in those back molars there. It can, be discomfort. Your cheek can kind of feel swollen like you see in the picture on the bottom. There's really nothing that we can do to expedite the healing. It's just like if you get a bruise or a little bump on your skin, on your arm or something, it will just take, the natural course of about 7 to 14 days to heal. Another thing to talk about is sensitivity after dental work. So colds and hot sensitivity is normal after dental work. We worked on the tooth. There's trauma to a living part of our body. There's little odontoblastic cells that live inside the pulp, and they are still getting those signals that something is happening in their environment. So it can take a couple of days up to 6 weeks to get better, and it will slowly get better with time. Now, this sensitivity shouldn't be something that lasts a long period of time. It should be something that is very quick and dissipates immediately upon removal. So if you drink, cold water, ice water, or some hot tea, you feel a little discomfort on the tooth, but as soon as that temperature is removed, the tooth goes back to normal. That's a healing tooth that will get better with time. If the sensitivity lingers for longer than a few seconds, or the pain or sensitivity is spontaneous, not provoked by anything inside the mouth, there can be a more serious form of inflammation that's happening inside the pulp at those odontoblastic cells, and that will require additional office follow-up and or treatment. So if you're having anything in this latter category, please reach out to the office so you can schedule an appointment to be seen. Another thing that can happen after a crown or a filling is that we'll have to do some adjustments to the bite in the days after the treatment is done. When we are doing these procedures, most people are all numb, like we just talked about, and so when they bite, they might be not biting with all of their typical forces that they place, and they're not getting that feedback of, it might feel tall or uncomfortable until the numbness wears off and they can really notice it the following day. So if you notice the next day that when you bite, it feels like something's bumping on your teeth, or it's, your teeth aren't fitting together like you remember, please call us and let us know. We'll have to do an adjustment on the bite of that crown or filling. And it doesn't get better with time. Some people think if they just, give it time, the bite will adjust or they can wear down the crown or the filling. This doesn't occur. So if after a day or two you're still feeling that, it's better just to be seen and us to adjust it, because it actually bruises the ligament that holds the tooth to the jaw, prolonging the discomfort in that area. So after we adjust a tooth, it can be pretty quick, within a day or two, up to 7 days or so, to allow that bruised ligament to heal, just depending on how the severity of the bruise on that tooth. So like we said, on some of those issues with the teeth after, we're always here, so please contact us with any additional questions or concerns. We're happy to answer those for you, and we can schedule an appointment if we think that it's necessary. Great. Take care. Bye.